Okay. Good afternoon, everybody. I'm Dr. Smriti Nayak. I'm a gynecologist and fertility specialist at Aikya Fertility and Research Center in JP Nagar. So today I'll be covering the topic of PCOS and infertility. So as we know, PCOS stands for polycystic ovarian syndrome, right? Now this word has been used a lot, or this terminology has been thrown around a lot because it's become very commonly diagnosed, and a lot of patients come to us with irregular cycles, or they will be having difficulty to conceive. So what is PCOD is the first thing to understand is what does the term mean. It's polycystic ovarian syndrome, right? So poly is multiple, cysts are water filled bubbles in the ovary, so which is usually seen on the scan. It is a syndrome because it also has other factors which help to diagnose or come to a diagnosis of PCOS, which is mainly standing at which comes to metabolic disorders along with endocrine disorders as well as reproductive and physiological systemic disorders. Okay, the prevalence rate comes up to around 3.7 to around 22.20%, and the main problems are chronic anovulation. There can be hyperandrogenism, and there can be polycystic ovarian problems, polycystic morphology in the ultrasound scans. Chronic anovulation is the reason for irregular cycles. So what happens in this scenario is usually the menstrual cycle is divided into two halves. That is, the first half is the estrogen, is the proliferative phase, which mainly has estrogen predominantly produced in it. The second half is the secretory phase, which has progesterone in it. So as you get your period, that is your menstrual phase, and then the proliferative phase starts. In this phase, the endometrium keeps coming up, and it also is the phase which is dominated by FSH, which is a follicle stimulating hormone. This FSH produces sort of helps to improve the number of follicles coming up, and with each follicle which comes up, it also stimulates the endometrium to come up. Okay, now this makes the follicles come up, and up to a certain time that the follicle grows, and once the follicle reaches a size of around 18 to 20 millimeters, that's when the ovulation happens. So this is the third phase. So once the follicle is formed, then the ovulation happens. That is your third part of the cycle. That's the ovulatory phase. As the ovulation happens, this is predominated by the hormone LH, luteinizing hormone. And once the follicle is ruptured or released, progesterone is the hormone which is produced. This brings about secretory changes in the endometrium. And that is the follicle which is responsible for the pregnancy. In PCOD patients or PCOS patients, there is chronic anovulation. That means there is no ovulation which happens. So your first phase of the cycle itself continues, and you will have a long estrogenic phase or proliferative phase. And because there is no ovulation which happens, there is no progesterone, and the period will not be there for at least 2 to 3 months. And you will only have a withdrawal bleed when the endometrium is so thick that it will undergo shedding on its own. Ideally, there should be progesterone which causes the secretory changes in the endometrium, and that should cause the shedding. That is why when a PCOD patient comes to us in the OPD, when we check the endometrium in the scan, it will be extremely thick, and for such patients we give progesterone so that it helps with the withdrawal bleeding, right? So when it comes to the evaluation or the assessment, we start off with understanding the history of the patient. How irregular are the cycles? What kind of cycles do they have? Do they get only withdrawal bleed only if they take progesterones? And then we have to also check the androgen levels, that is hyperandrogenism, and if there is, along with the biochemical signs of hyperandrogenism, we have to advise them to go for the ultrasound scans. In the ultrasound scan, we have to check for the ovarian size or the ovarian morphology. This sort of gives us an understanding of whether there is proper polycystic ovary or not. The volume of the ovary should be more than 10, and we see a peripheral arrangement of the follicles in the ovary with increased stroma. That is, the ovarian volume, it will be a bulky sort of an ovary. Okay, and that sort of helps us to give a diagnosis. And if a patient also has irregular cycles, we also have to go ahead and test the prolactin levels as well as the thyroid levels to understand if that may be the reason for the irregular cycles. So mainly ovulatory dysfunction is one of the key features of PCOS, and that leads to infertility. So when it comes to, again, what is the solution to all of this, we have to think of lifestyle. It's basically a multidisciplinary approach. It's not only the gynecologist, you also have to meet a dietitian, and you'll also have to meet a endocrinologist to see if there are to rectify your endocrine issues, like there can be hyperinsulinemia, there can be increased testosterone levels. So a multidisciplinary approach is required. And of course, you can take the help of certain support groups to talk to. You can understand what all they might be going through and what all has helped them to overcome this sort of a problem. So it's a lifestyle related disorder. This much we've understood from all of this, and to maintain a good healthy lifestyle is not easy in this day and age. Although it's easy for me to sit on the side and say, you have to work out, you have to eat right, you have to have a balanced diet. But at the end of the day, we all have 24 hours. So to try to understand how it impacts the disease is very important, because I've had patients who have actually lost weight and been able to conceive very fast without any issues. Okay, so again, when it comes to weight loss, how much weight loss is important? To answer this question, you should know what is your BMI and body mass index. That's what BMI stands for. The BMI should be well within the 25, that is your normal range. Around 20 to 25 is the normal range. The way to calculate the BMI is you have to take your weight and divide it by your height in centimeters and squared. So that gives you the BMI. Anything above 30 or anything above 25 is overweight. 25 to 30 is overweight. Above 30 is obese, and above 35 is morbidly obese. So any issues with obesity should be dealt with lifestyle changes and taking help of a dietitian to understand how to have a calorie deficit diet, to have a protein rich diet will help to lose the weight. Next, moving on to the lifestyle interventions that you will have to do. Almost having a physical activity of at least 3 to 4 times in a week, hitting the gym helps. And along with that, you can also focus on your mental health by trying to do some meditation, because both go hand in hand. Increased stress during this period because you're not being able to conceive, or because others are conceiving and you're having this PCOS issue, they all play ultimately into leading to hormonal imbalances. Okay, so what kind of pharmacological interventions can be done? We can start medications, right? We do something called ovulation induction. So what happens in this period is we give medications for the follicles to develop, and this helps with the formation of the follicles, which eventually lead to ovulation and lead to a pregnancy, which usually won't happen in the PCOD because of the chronic anovulation, right? So in ovulation induction, it's a very simple process. You have to come on the 2nd or 3rd day of your periods. We give you medications and call you back for a follicle monitoring scan after 7 to 8 days. Check on the growth of the follicles. If it's growing well, we don't have to give you any other extra meds. If it is not, then we may have to start injections. Ultimately, when the follicles reach a size of 18 to 20, we give a ovulation trigger shot, which helps for the egg to release. And once this egg is released, that helps to we tell that the patient, we confirm that the egg is released through scan again, and we tell the patient to be in contact or have intercourse in that period, so that there is a good chance of having a successful pregnancy, right? So then, this is the most common and simple form of treatment that we can give for a patient of PCOS. And if it works out, and up to 3 to 4 cycles depending on the age of the patient. But if it doesn't work out, we can also advise them to plan for a HSG, which is a tube testing. And then if the tubes are, patent and not having any issues, we can go forward to doing something called an IUI as well, where the husband's sperm sample is taken, filtered, and the small amount of good motile sperms is injected into the uterus using an IUI catheter. And this also helps in patients of PCOS because it overcomes any cervical factors of infertility where the sperms will not be able to penetrate into the uterus. So again, like I said, weight loss is extremely important. Having lifestyle changes is very important. And if you've had any issues with ovulation, like irregular cycles, then please come down for an ovulation induction cycle, like a follicle monitoring cycle, through which you'll be able to understand if your follicles are coming up, whether they're growing well. And once we determine whether it's not growing well, or you're having anovulatory cycles, we can give you ovulation induction agents and make sure that your eggs develop, and we'll be able to guide you as to when to be in contact to have the maximum chance of pregnancy. This is the simplest form of treatment, but also from your side, having lifestyle changes, trying to lose weight, getting on a good balanced diet, and reducing your stress levels is equally important. So in a simple way, I'd just like to say that PCOS is definitely increasing and on the rise, but it's all related to lifestyle. So choose your, the sources of your food wisely. Where is your food coming from? Is it having a lot of pesticides? Are there a lot of hormones being injected in the meat that you eat? So once you understand where the source of your food, you'll be able to know that you should stay away from the endocrine disruptors. These are that's the problem why it's becoming so rampant, is because there's a lot of adulteration happening, and we are also dealing with a lot of pesticides getting infused into our foods, right? And also the use of plastics, again BPAs, these are the poisonous agents coming into our body through the food that we're eating, which are causing disruption in our hormones. Okay, so ultimately PCOS can be dealt with. We can overcome this. Please do not be disheartened if you've not been able to conceive. You can always approach us. We can evaluate you, come to a proper diagnosis, and give you a proper plan of management to have a successful and a healthy pregnancy. Thank you for watching the video. Please leave your comments in the section below, and we will get back to you as soon as we can. Thank you.